inflammatory bowel disease, don't get like bogged down in the nitty gritty. You don't need to know as much as you did back when you were a med student. Crohn's disease and ulcerative colitis are the autoimmune diseases that we are talking about when we talk about inflammatory bowel diseases. So like he said, most of us is going to focus on Crohn's, but I'll mention some differences with ulcerative colitis. For the pathology, there's like a couple buzzwords that you probably remember from med school. So patients have to get an endoscopy for diagnosis of this. Crohn's disease can go anywhere from the mouth to anus, the entire alimentary tract, if you prefer. Ooh. Yeah, that's a word.
That's elementary, dear Watson.
The GI tract, the whole GI tract can be involved. You have these things called skip lesions where the inflammatory ulcers are interposed with like normal mucosa because they're not continuous. That creates like a cobblestone appearance of the mucosa due to those adjacent ulcerations and normal tissue. So specifically on the endoscopy, you're going to see longitudinal deep mucosal ulcerations in Crohn's disease. And another buzzword that you probably remember is transmural. That's because in Crohn's disease, the lesions can go through all of the layers, and that's why they can penetrate the bowel wall, causing the complications like abscesses and fistulas. And most patients with Crohn's disease are going to have small bowel involvement, especially the ileum. That's the place that commonly gets talked about in Crohn's disease. Different from that, ulcerative colitis involves only the mucosa. So they're not transmural. It's just the mucosal layer. And it's just the distal intestinal tract. It spares the small intestines.